Hello, Seagulls. Thank you for joining us. This week is Random Acts of Kindness Week. The City of Salisbury has its very own Secretary of Kindness, Grace Murdoch. She and I are encouraging everyone to perform a random act of kindness every day. We have some new information to share this week regarding testing and other topics. Joining me to discuss specific details is Victoria Lentz, Director of Student Health Services. Thank you, Vicki, for being here. First, our positivity rates continue to remain under 1%. This is due in part to the dedication of our campus community to wearing masks, distancing, good hand hygiene, and of course, testing. Today, we announced some changes to our testing protocols that will go into effect starting Monday, March 1st. These new requirements will keep the university in compliance with University System of Maryland guidelines and keep each of us safer in light of the spread of new variants of COVID-19. According to the new guidelines, rapid tests will now be used to test employees and students more frequently in order to maintain access to campus buildings. All SU faculty and staff who are on campus regularly must take an SU COVID test at least every 14 days. We are defining regularly as being here more than twice per month, but regardless, all employees must be tested within the previous 30 days to come to campus. All SU students need to take an SU COVID test at least once each week. All testing will continue in the Great Hall of Holloway Hall. We have new online sign-up mechanism in place. First, please check your SU email or visit our COVID webpage for more information, and make your appointments for the whole semester. Now, due to large numbers of SU community members who will be tested each day, please do not arrive more than 15 minutes early or late for your appointments. If you ever have questions about testing, you can email covidtesting@salisbury.edu. Okay, at this time, I'd like to turn to Vicki Lentz with Student Health Services to discuss some other information with us. Vicki, welcome.
Thank you, Dr. Wight.
So the first question, from your perspective and on behalf of the University Health Team, is there anything that you'd like to add about why we're doing more frequent testing?
Yes, the reason for the increased testing is the ability to catch the disease among students and employees. The University System of Maryland is requiring more frequent testing at all institutions, and our University Health Team worked close with state and local health officials to determine the best plan for our campus.
Are we able to test for the new variants that are circulating?
Yes, COVID specimens sent to the University of Maryland Baltimore lab are now being tested for the new circulating variants of COVID-19.
What about testing for those people who are symptomatic?
If you're experiencing symptoms or you fail the daily screening, you should immediately contact Campus Health, and a nurse will get in touch with you to provide information, resources, and testing if needed. Students should also know that Student Health Services is open and available to see students in person to evaluate their symptoms or any potential illnesses or any other potential illnesses. Most students are seen the same day that they request a visit. Student Health has the ability to perform COVID-19 rapid and PCR testing, as well as any other warranted tests, for example, our strep or flu or mono. A physical exam would be done to check all vital signs, including your oxygenation levels. We would listen to the heart and lungs, as well as perform any other parts of the physical exam. We're here to keep the students safe and healthy.
Thank you, Vicki. Do you have any updates on vaccines, including CDC guidance and reporting?
So currently, Maryland is in phase 1C for vaccinations, and some employees and students have had the opportunity to get vaccinated on their own or through their roles on campus. Once you are fully vaccinated, meaning you have received the first and second dose of the vaccine, the new CDC guidelines allow for you to forego quarantine as long as the following have been met. It's been at least 14 days since your second dose, you aren't showing any COVID-19 symptoms, and you have provided SU with the appropriate consent to get your vaccination information. It's critical for students and employees to sign that consent form in GullNet so that the medical staff can properly advise you. As always, email Campus Health if you have any questions on where to find the form.
Well, that may provide some welcome relief for those who would otherwise need to quarantine.
Yes.
What's your advice regarding double masking?
So yes, per the CDC, because of these new variants and the more contagious that some of these are, there are some recommendations to double mask. And that would be to wear a surgical or procedure mask underneath a cloth mask. And we do have lots of these procedure masks in the, at the COVID testing site, so please take some if you need them.
Do you have any other reminders for our students in particular?
Right. We really want you to remember that it takes all of us to keep the campus open. I know we're all getting a little bit fatigued by the various precautions, but there are hopeful signs. More people have been vaccinated, and the number of people who are hospitalized continues to decrease. Remember that we know that when most infections occur when people get together in large gatherings. So please limit these high-risk behaviors to reduce the spread.
Thank you, Vicki. That's good advice, and thank you for joining us today.
Thank you. You're welcome.
I'd like to thank you and the entire staff at Student Health Services, Campus Health, and as well as the University Health Team for all they've been doing for our campus over the past year. I want to remind our students and employees that Student Health and Campus Health are here for you. We've invested in these areas and we've set them up to best support our students and our faculty and staff during this time. For the past 11 months, students, faculty, and staff have gone above and beyond to adhere to the university's COVID-19 protocols. Thank you. Your efforts have allowed our campus to operate as safely and as effectively as possible last fall and this spring. And we're already looking ahead to next fall. Yesterday, we shared information about SU's potential operating plans for next fall. While none of us can predict the future, we expect that most classes will be delivered in person and most faculty and staff will return to on-campus activities. We are heartened by recent announcements that vaccines are expected to be available to the vast majority of the nation by this summer. We are planning for routine campus operations, but with reduced density in some areas. While that likely still will require some hybrid classes and the need for continued precautions such as face masks, testing, and distancing, we will be one step closer to a full return to pre-pandemic operations. SU is in a better position than many of our institutional peers. Last semester, about half of our classes were face-to-face or hybrid, while many other campuses adopted a fully virtual model. Currently, more than 50% of our classes are face-to-face or hybrid, compared with 25% or fewer at some of our sister institutions. While there are still many questions to be answered, the willingness of our campus community to follow safety protocols and participate in regular COVID-19 testing allows us to be successful and plan for a more normal fall semester. Next week, I look forward to welcoming SU Provost and Senior Vice President of Academic Affairs, Karen Olmstead, to talk more about planning for the fall and for events like commencement. Okay, at this time, I will take any questions that you may have. As always, please send them via email to stayinformed@salisbury.edu. Eli Maudlin, what are people asking about today?
Thanks, Dr. Wight. The first question is regarding testing. How will you ensure that testing availability is maintained if you're increasing testing?
Well, we have set up a very efficient testing operation. We're using the rapid tests, and that will give us results within 15 minutes instead of 40 hours. So we've done everything that we can to increase the throughput and reduce the waiting and any potential crowds. But it is important for people to show up for their appointment within 15 minutes of the scheduled time.
Thank you, Dr. Wight. The next question is about testing and vaccinations. If someone has received both doses of the vaccine, do they still need to participate in testing protocols?
Yes, indeed. The vaccination is not 100% effective, and especially with some of the new variants, there may be people who come down with mild cases of COVID even after they've been vaccinated. So yes, people who have been vaccinated will still participate in our testing protocols.
And Dr. Wight, could you speak a little bit about reporting, whether that's anonymous or reporting with your information? How would someone go about doing that if they want to report non-compliance with COVID-19 protocols?
Sure. This is actually an important issue because the university has recently been made aware of a few events that did not agree with requirements and protocols and led to some people being quarantined, a lot of people being quarantined actually. So we encourage everybody to report when you see behavior that is out of bounds. The easiest and best way to do this is to go to our coronavirus webpage, and there's a form that you can find there for making the report. The form allows you to make an anonymous report, but frankly, sometimes we have to follow up and get additional information for us to take action. And so it's very useful if you're willing to give your name and contact information. That way we can follow up with you and make sure that we really respond to the event.
Thank you, Dr. Wight. And this last question is for you just to repeat the requirement for the frequency of testing for students.
Yes, students, starting March 1st, will have to get an SU-administered COVID test once each week.
Thank you, Dr. Wight. Those are all the questions for today.
All right. Well, again, thank you for participating in all of the testing protocols and for keeping our campus safe through distancing and mask wearing and good hand hygiene. It's really important. I think that wraps up our briefing. Again, please join me and our provost for next week's briefing. In the meantime, thank you all for continuing to do your part to protect the flock. Thanks, everybody.